This Docs on Call is brought to you by Excellus Blue Cross Blue Shield and UHS. I'm here with Dr. Michael Lissy with UHS Orthopedics to talk about your labrum. Doctor, what is your labrum?
The labrum is a rim of tissue that surrounds your joints. Predominantly your shoulder and your hip have labrums.
And what is the risk factor or risk factors for a labrum tear?
They're a little bit different depending on the joint we're talking about. In the shoulder, the labrum is injured when you dislocate your shoulder, so having instability in your shoulder will cause a labrum tear. In the hip, the labrum is injured not so much by a dislocation, but more by pinching the labrum between the two bone ends. And that can be because your bones are malformed in some way and they come closer to pinching the labrum, or it can be because you're doing some activity repetitively, particularly in sports, where you're taking your hips all the way to the end range.
And the symptoms?
The symptoms in the shoulder is that you've dislocated your shoulder and you have pain and clicking and popping and maybe some loss of range of motion or some strength there. In the hip, it tends to be a little bit more amorphous. It tends to be a dull ache inside the hip, particularly in an athlete, and it just kind of hangs around and doesn't get better.
And how do you treat these?
You can treat them with just resting and stabilizing the joints with some physical therapy. Sometimes you need to have surgery. In the shoulder, you do a stabilizing surgery where you just reattach that labrum. The same thing happens in the hip. We can go in through a scope into the hip and reattach the labrum where it's torn off.
All right. Thank you, Dr. Michael Lissy with UHS. If you want more information, go to our website, wbng.com. To leave a comment or question, call 584-7362, 584-7-DOC.